Would you like to work closer to home, save money on gas, and be rewarded for your hard work and attendance? Then Bellisio Foods is looking for you. That's right, Bellisio Foods is now hiring for multiple positions and shifts with great employee benefits, an on-site health clinic, competitive wages, and advancement opportunities. Bellisio Foods is a company that truly values their employees. Apply online at BellisioFoods.com/careers.
Well, good morning, everyone, and welcome to the morning show right here on Main Street TV, where we have yet again a very, very special guest here in the studio. And of course, we love to have our friends here from Holzer. And today we have Christina Hively, who is something that I can't pronounce. So welcome.
Nice to be here.
Yeah.
I am a nurse practitioner in otolaryngology,
Yeah.
which is ENT.
I can do the nurse practitioner part, and I can say ENT, but the other one's tough.
It can be a pretty lengthy word.
Is that like one of those things that you start schooling and you immediately go, they tell you how to say that word?
Sort of.
Like,
Yes.
That's like ENT 101, that's the whole class?
Yes.
Pronounce the word.
Pronounce the words, many words actually. There's many words.
You're like, yeah, that's not the only word.
Yes, there are some pretty tough ones.
Well, welcome. We're so happy to have you here today because as I was reading down through some of the things that you handle on the daily, I feel like many folks out there are like, yep, that happens to me. I had no idea who to go to, who to call. And here you are today. So that's wonderful. If you would pull that mic up just a little bit so everybody can hear you. She's all quiet and stuff, unlike me, who's not. But I guess first off, we always like to have our guests kind of just tell a little bit about themselves. Where'd you grow up and go to school and all that?
So I actually do live local
Okay.
here in Jackson, and I grew up locally in Jackson. And so as far as my college years, my undergraduate was with Wright State University.
Okay.
And then my graduate degree is with Chamberlain College of Nursing, which is based out of Chicago, Illinois.
Okay. And how did you end up there from Wright State?
So it was a program that was offering what I was looking for. And I actually was working with the VA at the time as well that
Okay.
did recommend that program.
Awesome. Awesome. So to become a nurse practitioner, you go through, how many steps are there to get to where you are today?
So typically speaking, you are a nurse first, and I was a nurse for many years before I became a nurse practitioner.
Okay.
And so you may have a variety of backgrounds in nursing before you become a nurse practitioner. There are several tracks that you will do when you complete your nurse practitioner degree. You can go into acute medicine, you can go into family medicine, you can go into areas like that, pediatrics. So you do complete additional training on top of your nursing degree
Okay.
for your graduate degree. And so while you're completing that training, it's in several different areas, kind of like a residency. So you go to,
Oh, fun.
acute medicine, you'll go to primary care, cardiology, areas like that. And so you are typically trained in general medicine first, and then when you start somewhere such as ENT, you are trained hands-on with surgeons, and then you also receive academic training and additional certifications in those areas.
And that is so cool. And the nurse practitioner thing. I mean, how long has a nurse practitioner been? How long has that been a thing?
So nurse practitioners have been around now for at least 20 years.
Right.
At least.
And, go ahead. I'm sorry.
I was going to say, they've been practicing that long. It's sometimes confusing for the public and
Yes.
for even, providers sometimes about, what they do, what they're capable of doing.
Yeah.
But, that kind of varies a little bit depending on their training and what setting they're in. And so there is a slight difference between a physician assistant and nurse practitioners, but sometimes also their scope varies from state to state.
Really?
Mm-hmm.
I did not realize that.
Yep.
And I guess could you go on and just expound on what you just said, which is, the physician assistant, physicians, nurse practitioners.
Yep.
What can folks do?
So from an ENT perspective, for instance,
Sure.
We are trained to do minor procedures in the office. For instance, we take out wax. If we need to scope the nose, we can, and throat. We can diagnose and treat,
Okay.
similar to a surgeon.
Sure.
Typically, if we work as a team in a surgical specialty, so if you need a surgery or something that requires a little more invasive procedure, you're probably going to be seeing the surgeon, and he's going to be taking you either to the minor OR or into the main OR
Okay.
for those procedures. But we both, diagnose, treat medically on that side, similar, same. Physician assistants will play that same role in, for instance, ENT, surgical specialty.
Sure.
Now, in the community, you often see nurse practitioners and physician assistants in primary care, urgent cares, and things like that. Again, they play a very similar role. Usually, it's just the certification and licensing side of it. There's a slight difference.
All right. So as you were talking about your school career and then, to be a nurse practitioner, you do go through, as a doctor, you go through different, I would assume, rotations and things like that. How did you end up choosing ENT?
So ENT was an area that I was interested in because I hadn't really had as much exposure to it. My background was general medicine, ICU, things like that, cardiology.
Okay.
And so when
As a nurse. Okay.
And so that's honestly kind of a foreign, idea to a lot of people. They're like, oh, what is ENT exactly? What do you do?
Well, you can't even pronounce the name. So why would anyone want to do that, right?
Right. And so it is actually very in-depth and fairly broad. So we treat a lot of disorders of the ear. So we call those otologic disorders. So, general ENT, and then there's even subspecialty in ENT. So otologists, for instance, work only in the ear. Laryngologists work only in the throat. Rhinologists work only in the nose. And there are certain situations when, in general ENT, we do cover a lot of those things. But if there's something specific that we need them to work on, sometimes we will refer to them. But we cover many, many things. So disorders of the nose, breathing disorders, sinus disorders, issues with the throat. We, cover problems swallowing, hoarseness, or problems speaking. We also cover, if you have an area that pops up like a lesion and or ulceration on the skin or on the mouth, pretty much everything from here up on that side. And so we do, handle a lot of head and neck cancers and also thyroid disorders. If you have issues with the thyroid, if you have thyroid nodules, if you might need some surgical intervention for that, and parathyroid disorders.
Okay, and what's that?
So the parathyroid is a little gland that sits at the back of the thyroid, and it helps to regulate different levels in your body, calcium and things like that.
Oh.
And so there are certain times when you may get growths or something on that gland, and you may need it addressed.
It's interesting, and this is just me speaking personally, but your thyroid, could you talk about what your thyroid does? Because you hear about that a lot, and I have a point to this, and I'll tell you my story here in just a moment.
So from the ENT perspective, we look at it more on a surgical side.
Okay.
But you do pretty much hand-in-hand partner with endocrinology.
Sure.
Right?
Yes.
And so your thyroid does run many things in your body. It really works on that metabolic system. And so if you have thyroid nodules and little growths that are developing, from our perspective, we watch those. We determine if they look suspicious, if they need to be removed, if there's a concern for thyroid cancer. And sometimes, depending on the size of the thyroid, you might have problems with swallowing and other things like that. But in general, the thyroid itself does run a lot of different functions hormonally.
It controls a lot, doesn't it?
Yes. a lot of, like I said, metabolism work on that. So you feel hot, cold, sometimes that can be affected by it. It can cause weight changes and fluctuations. But in general, there's a lot that the thyroid does impact.
It does. And my point for asking you this, and I guess I was just going to ask you personally, how do you see a lot of thyroid issues around here, people having growths or things like that?
I feel like it's probably about average compared to other areas.
Okay.
Because I did work in Ross County in ENT for many, many years. My experience, I've been in this specialty alone for greater than 7 years.
Okay.
So I've seen quite a bit of thyroid nodules, for instance, in Ross County. So I feel like it's about average, probably compared to other areas.
Well, the reason I ask, and I thought this was kind of strange, is occasionally I get together with my girlfriends from high school.
Yes.
We all get together as some have moved away and whatnot. And we were all having a discussion, as you as you get older, but these are your girls, right? Like you're all the same age, so you're going through all of the same things together, and the tales of woe and health and all that stuff. But we were sitting there one day, and I think there were 6 of us, and 5 had thyroid issues. Mm-hmm. And it dawned on me, and I have some were had to have surgery and have some serious stuff done. Yeah. Some were oh, I'm on medication because my thyroid isn't working properly. Myself, I just have a cyst or something on my thyroid that they've watched and nothing's happened with it. So they just kind of let it, go. Yep. But I was just thinking to myself, is that strange that there are 5 or 6 of us sitting here and 5 of us have a thyroid story?
To be honest, thyroid nodules, for instance, if you did an ultrasound on a lot of the population, you're probably going to find them.
Okay.
In most situations, sometimes thyroid nodules are incidentally found. So they get a CAT scan or they've had another scan of some sort and they see it. And so most of the time, these are small or cystic nodules that are benign or non-concerning, but there can be cases where that's not true.
Sure.
And so that's why we watch them. But most of your population, to be honest, probably does have little growths.
Okay, so that's not an abnormal thing.
Like I said, if you were looking for them, probably not.
Sure.
But, we see it a lot because of the specialty. Like I said, endocrinology is another one that watches the thyroid. They actually manage medically, the thyroid, diabetes, things like that.
Because I had seen both sides, your side and endocrinology, and they said, oh, you're fine. Go away. No, they didn't really say that, but yeah, they said, don't panic. You're fine. It'll be fine.
Yeah. It's usually a process of waiting and watching.
Yeah.
And like I said, to determine what they look like, how big they get, is there a concern for maybe something a little more sinister or not?
Okay.
And most of the time there is not.
Okay.
It's usually, tiny little benign growths. Again, there are situations where that is not true. But we watch them for the majority of the cases.
That's your best case scenario. You hope that
scenario.
That's, they say, go away, don't panic.
Right. Yes, best case scenario.
Yes, love that. Okay, well, let's get into some of the things that you do, that you personally treat. First off, where are you working? Here locally or in Gallipolis?
So I actually am working at the Jackson location here at the clinic.
Okay, the one on the hill.
Yep. And then I also work a day in Athens as well.
Oh, great. Okay.
So I'm at the Athens location, and I am here in Jackson. So
okay.
We work both those locations, and we are accepting new patients. I see adults and pediatric patients.
Oh, okay.
Yep. And like I said, for variety of issues. Variety.
Well, let's talk about that variety for a little bit. I can remember being a little kid and so had to go get tubes put in their ears and, whatever. Is that still a thing? And why is that a thing? And what do you see with kids, starting with them first?
So typically when you mention tubes, most people think kids.
So had to get the tubes.
Yes. Most people think kids automatically. There are some adults that do warrant tubes. Sometimes.
Okay.
But yes, we do frequently place tubes in children. The reason for why you're going to place a tube in an adult or a child is you have something called a eustachian tube that actually opens right in the back of the nose and throat. And it ventilates your ear or keeps that pressure equal in your middle ear space.
Okay.
And if there's some dysfunction or if it's not opening and closing well, sometimes you will get the issue of having what we call like a negative pressure behind the eardrum, which is that pressure sensation you might feel. You can get fluid in that area and behind the eardrum. And with children especially, as they grow and develop, those tubes will kind of come down a little bit or change in their structure.
Okay.
And so that's why they grow out of them, or notice as you get older, oftentimes you may not need them. But as young children, the anatomy is a little different where the tubes are a little more straight. And so that's why it's harder for them to drain well. But
Gotcha.
as we get older, that changes usually. Other factors for that are allergies. So allergies
Welcome to Ohio.
to Ohio. They do cause a lot of inflammation in the back of the nose and throat where those little openings set.
Yep.
And so oftentimes with adults and children that have a lot of allergies, you will see tubes a lot just because there's that constant inflammation there. And so those tubes can't aerate those ears very well.
Okay.
And so what the ear tube does is when you put it in the eardrum, it aerates that middle ear space. And it also allows the fluid to come out if it gets stuck in there. So
Okay.
it's basically looks like a little spool of thread. And so one
Oh.
opening is behind the eardrum and one opening is in front of it. And so it will come through the tube and out the ear if you have fluid.
And how on earth do you get that in someone's ear?
So
That sounds like horrible. But
Well-
I know it happens all the time, so it must not be that.
it's really not that bad.
It sounds horrible.
They're very tiny. They're about the size of the end of a pin, very tiny.
Oh, okay.
And so with children, typically we do take them to the OR. With adults, if they're tolerable to it, we actually do place them in the office, oftentimes.
Oh, okay.
Or in a minor OR setting. So children just often, it's a little harder for them to hold still or tolerate the
Yeah,
situation.
and they're
as well.
scared. I
And they're
get it.
scared.
Yeah.
It's a little scary for them. But yeah, we basically do a little procedure on the eardrum and place it right there.
Okay, and it's kind of like a vent pipe or something.
Correct.
Yeah.
Yeah, that's a good way to describe
Like
it.
you vent out your toilets and your sinks and your
That's right.
all of the other things. Yeah, so why not?
Yeah.
So okay, that makes sense. And then as you said, a lot of kids I think outgrow that, right?
Over time, most kids, if it's an issue of, just a faulty eustachian tube when they're small, a lot of kids do outgrow it. But again, if there's different components that add to it, allergies, whatever the case, sometimes you might notice it a little longer as they get older, or even long term. But there's other factors, like I said, to that. But usually they do get older and it's not so much an issue.
Okay. All right. So what are some other things you treat children for mostly?
So, like I said, obviously tubes are a big one. Kids also get a lot of tonsil infections. Right? So a lot
Uh-huh.
of big recurrent tonsils. Kids also sometimes have the problem with snoring. And
Really?
and so when kids often have those big tonsils, sometimes that can lend to the snoring.
Okay.
And so if you're getting a lot of strep, we probably do need to take a look to see if we need to take them out because of that reason. Also, if they're really big and they're causing that obstructive symptom,
Sure.
we do need to evaluate you for that to maybe take them out for that reason as well. So usually when we take tonsils, oftentimes this goes hand in hand. Your adenoids set in the back of the nose, between the nose and throat and your mouth. So they're behind the nose. And so we usually take the adenoids when we take tonsils.
And what are they there for?
So adenoids and tonsils are what they call lymphoid tissue. So you know how
Okay.
you have your lymph nodes.
Sure.
And lymph nodes like to drain infection and lymph tissue. And so same concept, your adenoids and your tonsils help to drain that lymph, fluid and any infection that you're getting from above. Now, again, depending on their size and if they're harboring things like strep,
Sure.
they may need to come out.
So it's interesting. I have a friend who is much older, and he's a doctor. His dad was a doctor, family doctor, old school, family doctor. And he was telling me that his dad, who I mean, is not with us anymore, it would be a long time ago. When they were kids, he just all the tonsils went. Didn't matter whether they were sick, whatever. And I was like, whoa. But he's like, I've never had strep throat and whatever. So I don't know that we would go to that extreme.
Yeah.
But I can totally understand why someone would have that philosophy, I guess.
Yeah, I do often get stories from, we'll say, older adults or middle-aged adults, and they're like, they took these out in the office. I'm like, oh. But, there were lots of different methods back then, and you know how medicine is. Things advance and change a little bit, and they find that there are certain things that are maybe a little better than others. But,
Sure.
yeah, I mean, back then, they took lots of stuff out, and they were just like, well, this will kind of be preventative, maybe.
Yeah, I mean, I get the philosophy. I just don't know that that was the best idea. But so, how have the tonsil procedures changed? Because you used to hear about, kids would have to stay in the hospital and they'd get the popsicles and all of that. I've never had my tonsils out, so I don't know.
So there are a couple various different methods to removing tonsils. And your traditional method is where you basically take the entire tonsil and you cut it down to the capsule. In recent years, which is one of the methods that, for instance, Dr. Cosenza uses, is what we call an intercap procedure.
Okay.
And so you're co-blading or burning down that tonsil tissue to the tonsil capsule. And so there's a lot less bleeding, a lot less post-operative pain with that method. And, Children's uses that method as well. And so that in the ENT community and in head and neck surgeons, that's been your most agreed upon method, we'll say, in the last few years. Traditionally, what they were talking about as far as cutting them out, yeah, it was a little different than, for instance, like the intercap. And technology, as it changes, you have like hot and cold cautery in different areas, different ways that they take them out. And so as they advance and find things that cause less pain and less post-operative complications.
I think that's the main thing, right?
Exactly.
Get you back up and going again quickly.
They use those more so because you have less swelling, right?
Sure.
After the fact, and you have less pain, and it's quicker for them to recover.
Okay.
From that. Now when you get your tonsils out, you typically come in. It's a same-day procedure.
Okay.
For the most part, unless you have some reason why we need to keep you over. And they come in, we take them out, and they go home.
Okay.
And so lots of soft food after.
So dang it, Mom's going to have to provide the popsicles.
Jeez. Yes, I would avoid reds and purples.
Yes.
But yes. Otherwise, Mom gets the popsicle.
Very, very good. Or just ice cubes or something, right?
Yeah, just the plain ice, Mom, really.
Yeah, right. Yeah, that's boring.
Harsh.
That would be rough.
I really do tell my patients, hydration is key.
Okay.
When you get the tonsils out, because the better hydrated you stay, the less pain you may actually feel, because when you get dry, you're going to feel more pain.
Sure.
And so then they don't want to drink. So you want to stay
it's
frequent
a cycle.
hydration. Mm-hmm. Frequent hydration to keep things moist. And then you also have less of a chance to bleed.
Okay.
Because, bleeding is a small percentage. It's a very small risk, but it is, a possibility. That's why we give you certain things after, like don't lift so much and things like that.
Okay. That makes sense. Totally. All right. And so as we continue on with the kids, I know obviously tonsils, the tubes, anything else that you see chronically for kids?
On occasion, you will see some sinus issues that we address, depending on the age of the child. Same thing, nasal congestion, things like that. Mm-hmm. Kids that are in sports often may get their nose hit, a time or two. That does happen. So
it used to be straight. Now it goes this way. Yes. I don't know.
But yeah, nasal bone fractures can happen.
What about that deviated septum?
Yes.
Lots of deviated septums.
Yes. Usually, unless it's causing a significant problem. Now, if it is, sometimes we'll address it when they're a little younger, but Sometimes when you break the nose, the deviated septum occurs, and that may need addressed a little later so that they can breathe better.
Why can I only breathe out of one side of my nose? Well,
Yeah, that would be why. But yeah, I think wrestlers, you often see what we call a cauliflower ear.
yes, that's a thing. Yeah, sure.
So basically, if you apply or hit that ear with a lot of pressure, sometimes your cartilage, you have a swelling of the skin and cartilage, and you'll get blood that gets stuck in there basically. And sometimes you have to drain that.
Okay.
And so it'll get larger than the other ear. And usually time is of the essence because
Gotcha.
if it's there too long, sometimes it can cause, permanent thickening of the ear.
Yeah, I mean, we've all seen that.
Yes.
And you're like, oh, you're a wrestler.
That's exactly right. Yeah.
Okay. But it can be helped if,
It can
if
be
you treat it.
drained. Yeah, for the most part, unless it's a recurrent problem, sometimes it'll still thicken. But yeah, if you treat it or try to drain it sooner versus later,
Okay.
oftentimes it can kind of return where it needs to go.
Very good. That's good to know.
Good to know.
Yes, absolutely. As sometimes guys don't care as much, but there are so many, as we have a wonderful girls wrestling team here now in the area. And I was just thinking girls might be a little bit more,
Yes. They might care more about their
we're vain. We're more vain, right?
It happens.
And that's okay. That's all right. Okay. So moving on, ENT, ear, nose, and throat. So what are the main things that you see on the daily as far as adults go?
Adults. Oftentimes, adults come in for, again, tinnitus or hearing problems.
Yes.
Decreased hearing, tinnitus. We do see a fair amount of dizzy patients. So if they're having the dizziness symptoms.
Okay.
Of course, wax or cerumen, if you're getting a lot of wax building up.
Okay.
There are the other issues that we discussed earlier, which is, problems swallowing, hoarseness, sinus issues, nasal issues, problems breathing.
I mean, how do you know if it's just Ohio or you should be seen?
So we do take a look at those things. And so
because it is just Ohio a lot.
we often, we're hand in hand with allergy. And so we can start that medical management. We call that what we call chronic rhinitis, or that inflammation of that nasal tissue that results from often exposure to allergies.
Okay.
And so from a surgical perspective, our job is to see if we need to open up that space so that you can breathe a little better.
Okay.
Or maybe open up those sinuses so that we can get those medications into the sinuses or into the nose better, and so that you have less symptoms.
Okay.
And oftentimes, like I said, we do work hand in hand with allergy, where you may see an allergist and we may say, okay, I need you to see the allergist to see if there's something specific that you're allergic to, or they can do a panel on you. And they can also help tweak that medical management too.
Oh, that makes total sense. And is that all within the Holzer family?
Yes. We have an allergist within Holzer, Dr. Clark. He's in Gallipolis.
Okay. And how do you know if it's just, a seasonal allergy versus, oh, this is something chronic and I should go see about it?
So consistency, are you having lots of sinus infections? Are you having frequent all year long infections that are occurring and inflammation? Do you know in the spring you often get sneezy and congested for a couple weeks and then it goes away? Or is this, spring, summer, and fall? Or is it I'm around this and I'm constantly congested type situation?
Okay.
So consistency, is this occurring a lot? Or is it just every once in a while
That makes
type
sense.
situation? So
Is it just Ohio?
I do see a lot of patients that will move, from other areas, and they do tend to have a lot more issues with Ohio.
I mean, why is it that I can go and, fly to Florida or get on a cruise or whatever, and immediately I'm like, I can breathe. This is wonderful.
Well, apparently we have lots of trees and bushes and things like that will cause this problem.
So here's the thing. The very thing that we are known for, our beauty of our area, is also what causes all the sniffles.
That's true. Yes. Yep.
I don't know. It's a give and a take, right?
It's give and a take. Yes, for sure.
So let's talk about hearing problems for a moment because you mentioned the ringing in the ears, or is it tinnitus or tinnitus? How do you say it?
So in ENT, we typically say tinnitus.
Tinnitus. Well, let's say it properly then. Tinnitus.
I don't think that there's technically really a wrong way to say it, but
Okay.
tinnitus is how we typically say it in ENT. But tinnitus is a noise that occurs in the head or ears. It occur one side or the other.
Or both, probably.
Could be both.
Yeah.
Often is both, or sometimes it's hard for the patient to identify, which
Gotcha.
side. It's subjective, meaning the patient hears it, but you don't necessarily hear it around you, typically.
So you're making it up. No,
No.
I'm just kidding.
A lot of patients,
We know it's a thing.
a lot of patients will be like, I heard this noise, and I kept asking my family member, do you hear that? And, they don't because they're the ones hearing it.
Yeah.
But it's described differently. Some people describe it as a ringing. Some people describe it as a buzzing or a humming or a roaring. I've heard crickets,
Oh,
There's various
yeah.
different descriptions of it. There's many different reasons why you can have tinnitus.
Okay.
Oftentimes it does go along with hearing loss. So, as a workup for tinnitus, you're frequently going to get a hearing test to see, do you have some hearing loss? Is it a high tone hearing loss? Their medications can cause it. Certain medical disorders like thyroid dysfunction and things like that can cause it. There are certain factors that can increase that intensity of tinnitus or make it seem louder to you. Stress is one. Stress
Okay.
is a very big one. Anxiety is a big one. Caffeine, nicotine, aspirin, or NSAIDs, because they increase that side of things, or changes and fluctuations in your blood pressure can also.
Interesting. Now, where does this, because I know, for example, my father-in-law, and I don't think he would mind me telling this because we talk about it a lot. He ran heavy equipment for years and years and years. And, I mean, we're talking like heavy equipment. And he said, God bless him, he can't hear a thing. And he said that he just has a constant
Noise.
ringing. Could that be caused by damage due to running heavy equipment? Or,
correct.
Are there things that we could do, A, to prevent it? And then if it's too late, are there things we can do to help?
So,
Because it drives him crazy.
as far as hearing loss, it's never too late to wear hearing protection. And if you are around any type of loud noise, whether that be recreationally or occupationally, I do recommend that you wear hearing protection.
Even your lawnmower.
Even the lawnmower.
I mean,
It's very loud.
get off your lawnmower and how do you feel?
Correct. You should be wearing
it's crazy.
headphones or something to protect you. But
And not headphones like so loud that you can hear your music.
no, that's kind of counterproductive.
Yeah.
But yeah, no. Usually if you have that constant steady noise, so in individuals that have worked around either heavy equipment,
Yeah.
some people that worked either in factories or somewhere where that noise is constant and loud, even sometimes with hearing protection, you may get a little bit of loss in that higher tone.
Okay.
And so you often see that in someone who has been around heavy equipment for a long period of time because it does contribute to the hearing loss.
Okay.
We call that presbycusis, or age-related, or sometimes it can come about because of a little more damage that occurs in the cochlea to those cells, again, from the constant noise.
Okay.
And so it's never too late to wear hearing protection. Even if you have hearing loss, it's never too late to wear it. Especially in this area, I tell lots of people, if you are recreationally shooting or hunting, do wear hearing protection.
Oh, I never thought of that. Just firing a gun would be.
Yes. And sometimes it only takes once.
Could I
Depends
tell
on
my
how long.
neighbors that?
For sure.
That seem to enjoy that a lot.
Yes. They definitely should have some hearing protection.
I feel like I need hearing protection.
Yes. That's very important
Okay.
because once it gets to a certain point, then we talk about hearing aids, right? If you have enough loss, and depending on the area where the loss is, you may be ready for hearing aids.
Okay.
There are noise canceling features on some hearing aids too, but meaning if you're having lots of tinnitus or noise. Sometimes they have that feature to them too. But
Really?
usually with tinnitus, we recommend a white noise or a distraction technique to where you have a low fan or a music or something playing if it's super quiet, because your brain will start to notice that sound when it's super
You focus
quiet.
on it.
And so that helps to distract away from it. So the brain
Okay.
will focus kind of away from it.
Is there any treatment for it? Like things that you
Unfortunately,
can do?
with tinnitus, again, there's things that can increase the intensity that I mentioned.
Okay.
And so sometimes reducing those things can reduce the intensity of it.
Like caffeine or stress? Okay.
Correct. But unfortunately, there's no 100% cure to stop tinnitus most of the time. It's usually just, again, distraction, white noise, sometimes increasing things that may increase that intensity.
Okay. And I think that the main thing too is to make sure that you get checked out. So here's what I hear. Well, I can't afford hearing aids, so I'm just stuck with it. What would you say to that?
So have they had their hearing tested would be one question.
Sure.
And, unfortunately, sometimes hearing aids can be expensive, but, there are programs out there as well.
Yeah. Is there help for people?
Sometimes audiology is the one we always send our patients to audiology to talk
Okay.
to them about hearing aids and the options that are there.
Okay.
Sometimes there are options through different types of insurance. Sometimes there's, other help there. Again, that's kind of audiology's thing.
Okay.
They are very in depth with that, and they will do the best they can to try to get them what
Okay.
they need.
Is that within the Holzer family as well?
That is.
Yay!
Yes. We have audiology actually there in the same office as ENT.
Oh, perfect.
Yes.
That works. I love when a plan comes together.
Yes. So yes, you actually may see us and then may see the audiologist the same day.
Okay.
Sometimes, or you may see them first and then us right after.
Okay.
So
That's
we are
fair.
all in the same office.
Very good. And if somebody, is having hearing problems or something, do they need a referral? Can they just call and make an appointment with you?
We do not require a referral.
Okay.
So they could call and make an appointment with audiology if
Okay.
they're having the hearing side of things. They can also call and make an appointment with ENT if they need for ENT related problems.
Okay. All right. Very good. So I heard you talking with Matt about the Q-tip thing, and I'm probably much older than he is, so I remember the commercial that he was talking about. I'm sure Adrian over there doesn't. No. You don't stick anything in your ear but...
Your elbow.
Yeah. It was a commercial. It was a Q-tip commercial years and years ago, and I can remember it. Like when he said that, I was like, "Your elbow, hello," because that was a thing. But so many of us get the Q-tips and start digging, and I'm guessing that's a big fat no-no. Like that probably makes you cringe to think about it
Yes.
in your profession.
Usually when I take a look in the ear, there is evidence that there has been a Q-tip there. It's very often the case. Usually that wax will just kind of move closer to the eardrum. A lot of people will put it in there and they're like, well, I got some wax on the Q-tip, but it's just basically you're just kind of smearing it on there, but it's moving that wax closer to the eardrum.
You're pushing it. You're not
pushing it.
digging it out. You're pushing it.
You're packing it sometimes.
Yes.
And so that can in itself cause increased tinnitus.
Okay.
It can cause decreased hearing,
Okay.
fullness. And the other thing I see a lot is people like to dig with Q-tips if their ears are itching, which is
It's
big
a thing.
no-no.
I mean, I have itchy ears. I know. It is a thing.
That's a big no-no.
Yeah. I don't dig with Q-tips. I want you to know. I don't.
I hope it's not an object or,
No.
your fingers.
No.
A lot of times you can get a lot of trauma to the ear canal when you're really after it with a Q-tip or an object.
Okay.
We'll say object, or fingers. So that can cause outer ear infections. A lot of people call them swimmer's ears, right? So, but the more you dig or the more you're after it, the skin is very thin in the ear. And
Okay.
so you can make little cuts in that skin. And especially if you're touching that ear with your fingers, even if you're washing your hands frequently, you can implant bacteria and things down in the ear.
Yeah, because our fingers are pretty gross.
Yeah, it's I just tell everybody just stay out of the ear. Just stay out of the ear. So with wax, what we usually recommend,
Sure.
there is an over-the-counter product called Debrox.
Okay.
And so it's like an oily type product. You can use it a couple drops, a couple times a week or once a week for maintenance. Mineral oil is also okay to use. Peroxide soaks are okay to do.
Okay.
Again, once a week or so is fine. A couple drops.
But what does that do? I mean, if you have a lot of earwax in your ear and you put a couple of drops of something in there, does it dissolve it? Does it fall out? Does it, what does it do?
So a lot of times those agents either help to break down or soften that wax and
Okay.
get it to come out of the ear better.
Okay.
So kind of come on out versus sticking in there.
Okay.
And so you'll a lot of times see chunks or pieces come out, or it'll kind of drain out and you can kind of get it as it comes. But
Okay.
it doesn't, peroxide, thins it down a little more, especially you get that bubbling sensation.
Sure.
Sometimes, it depends on the type of wax you have. If it's a dry wax, I would definitely go more side oil
Side
versus, peroxide. But I also, I warn people, and this is what I tell everyone, if you've had ear surgery or if you've had ear tubes or if you've potentially had a hole in your eardrum, do not
Sure.
put liquid down in your ear or oil
Yeah, that makes sense.
because we do not want that in the middle ear space.
No.
And so you'll definitely know it
Okay.
if you did that.
Oh. and it's not good.
It's not good. It's not good. So I would definitely avoid that. If you have that history, go to ENT. And I'm sure most people that have had those type of surgeries, they know they've been established with an ENT.
Sure.
But even if you have had a history of that, go to the primary or see us and say, is this safe to do? Type
Okay.
situation.
And the main thing is, if there's any question about your ears, also just ask your family doctor, what should I do?
Right. And
Is this a problem or is this
Right.
normal or?
And like I said, we don't require a referral. You can give us a call and say, hey, can you take a look at my ears? I think they might need cleaned. We do clean the ears.
Okay.
We use instruments to clean the ears. And so if you feel like you're
Like
having that issue-
sanitized ones.
yes,
Like
They
not
are-
your fingernail.
no, they are sterile. So yes, we do clean the ears with instruments, but they are sterile.
Yeah.
So yeah, it's not the piece on the keys.
No.
no,
Oh God.
no. See that a lot too. No.
No.
But yeah, no, it's not that. They're sterile. But
Okay.
yes, we are happy to take a look and see if we need to clean them
Okay.
for you or if something's going on.
What does cause earwax? Like, where does it come from?
So earwax builds up. It's an antibacterial agent, and it actually forms to help prevent infection. And
Okay.
so it is not a bad thing to have in there. Now, sometimes it will build up. The consistency of wax sometimes is different per person.
Okay.
Sebaceous glands, which make sweat, are also contributing to wax formation. And so as you get older, that will also change. So that's why some people's gets a little drier and other
Okay.
people's is a little thinner or oilier.
So this has happened to me, and I talked to the ENT about it when we were talking about the thyroid thing, is I feel like my ears run. Does that make any sense?
Do you use Q-tips?
No.
No?
I don't.
Do you itch your ears?
I probably do.
Yeah. Sometimes I see this a lot, sometimes with patients. If they itch the ears a lot, you can create, again, that irritation on that skin.
Okay.
And it will create a clear fluid, is the best way to put it.
Okay.
And that's your body's way of trying to protect that skin.
Oh, so it's
So
saying...
it'll kind of weep, is the best way to put it.
Okay.
And so if you're itching them a lot, sometimes that will happen.
Maybe I do, and I don't realize it. I'll have... Oh, now it's on. I'm going to see your face every time. I'm going to be like,
I
oh,
can't
no.
do it.
Don't itch your ears.
The other thing, sometimes, itching is often a sign of allergies. And so
Yeah, tell
sometimes-
me about it.
Yes. Taking that antihistamine will help reduce that down. Sometimes ears get dry. Some people do have eczema in the ears, the outer ears.
Oh, okay.
And so, again, that dryness contributes to that too.
Very good. Okay. Yeah, and I mean, it is a person-to-person basis, right?
Yeah, it's hard to say without looking in the ear 100%. But I will, like I said, my biggest thing is I caution people on the TikTok because there is you know,
Wait.
a late movement of TikTok of putting things in their ear.
Stop.
I don't recommend that. So
No, don't do that.
no, don't do it.
Although it keeps you in a job, right? So
For sure. Yes, I've seen some of those recently, but yeah, don't do
Oh,
it.
God.
Don't do the latest trends on TikTok in the ears.
or any latest trends on TikTok.
You know, I also caution people with the little cameras and the things that you can buy to clean out your own ear.
I mean, well, okay. Let's talk about that. I mean, they're everywhere. You know, you stick a candle in your ear and it sucks the wax out and all that. I mean, does that work?
That does not work.
Okay.
It's actually, I'm assuming the wax that you're seeing that's melting is actually from the candle.
From the
It's probably-
candle.
So no, with the little cameras too,
There's like little ear suckers that you can.
you want to be very careful about. For one, again, you really shouldn't be sticking anything down in your ear
Okay.
because a lot of people are like, well, the eardrum's way down in there, but it's really not. It's not as far as most people think.
Okay.
And so when you bump into that eardrum, it's going to hurt and you can cause a lot of damage.
Okay.
And so the same thing, you know, we have little tools and stuff we can get out that wax with.
Okay.
But I caution you on that because a lot of times, you know, if you're not trained on what you're looking at, they don't really know where they're going. And so you're like, well, I see the wax and I'm trying to get it out. But
Oh yeah, that just sounds awful.
yeah. So I would caution people on those
Okay.
as far as using those.
Yeah.
So we don't want to cause trauma.
How about you just see the doctor? It could save yourself a lot of money in the future.
Yes, just come see me.
Yes.
Just come see me. We'll clean it
She's
out.
lovely. Come see her.
Oh, thank you. Thank you.
Okay, and Pete Wilson is in the house, but I did want to ask you about nosebleeds. I know that's another thing. My husband, for example, will just be, you know, I think he maybe gets like 4 a year, but he'll just be standing there and all of a sudden the nose starts pouring.
Yep. So with nosebleeds, oftentimes they are caused from nasal dryness. And
Okay.
so you can sometimes stop or prevent, especially if they're minor, the nosebleeds with saline spray, which is an over-the-counter spray,
Okay.
saline nasal gel application,
Sure.
humidifiers
Yep.
in the home. That's helpful. Now, depending on how often you're having it, and you know, there are other factors that can cause other things that can cause those nosebleeds. So sometimes, you know, there's a vascular situation where those vessels come to the surface, or you have a lot of prominent vessels in that area. They may crack or pop open.
Okay.
But there are different reasons sometimes why you can get nosebleeds. So the best thing to do is kind of watch, again, consistently, like, how often are you having them? Are you having them pretty frequently?
Sure.
Is it one-sided? You know,
How much is frequently?
I would say a couple times a week.
Okay.
Even minor nosebleeds, you know, if you're getting just a drop or two. If you're getting them a couple times a week, you may need to see someone at that point, especially children, you know. But a lot of times with children, sometimes adults, irritation or digital trauma, we'll say, can contribute to that too.
Okay.
So moisture is what I would definitely start with.
Okay.
And if they persist beyond that, you definitely should be seen.
Okay.
But if you're having them several times a week or even many times a month, I would say you probably need to be seen at that point.
For sure. And it's so scary. I mean, you're like, oh my God, there's like blood pouring out of my nose.
They range, you know, they can range from real minor, couple drops, to heavy.
Yeah.
And, you know, it is scary for some people when they're really heavy.
Sure.
Because you can bleed a lot from the nose. But when that happens, what I tell people is you want to hold pressure here.
Okay.
Not up here, but here. If you have Afrin, which is an over-the-counter medication at home, we do
Okay.
not recommend the use of this really frequently or often, but you can use it during a nosebleed to help slow down the bleeding.
Okay.
If not, you know, just pressure.
Okay.
You know, and if you need to blow out clots, because
Yes.
oftentimes you will clot,
Yep.
you can gently blow them out and then hold the pressure back, or if they're coming down the throat, spit them out gently.
Okay.
If you do this for 20 minutes or so, you're holding pressure and it doesn't stop, or it gets heavier or worse,
Yes.
you're going to have to go to the emergency department.
Okay.
But like I said, especially if it's consistent, it's happening often, several times a month or several times a week, it's one-sided, especially, you know, come see us and we'll see what's going on. You might just need a simple cautery, but you may need something else, but we can take a look. You may just need some moisture in your life.
Right. Moisture in
need
your
some
life.
moisture.
Don't we all need it? Drink lots of water. I don't know. All right. Well, very good. This has been so fun talking with you today. How do people make an appointment if they would like to come see you?
So they can either go to holzer.org.
Okay.
And there is a way to make an appointment with me there online.
Okay.
Or
Very
they can
fancy.
call 1-855-HOLZER.
Yep.
And make an appointment there.
Yep. And you just say, I would like to see Christina Hively, and she seems like a real nice lady.
Thank you.
And we need her to fix me up.
There you go. And I'll be there.
I love that. Okay, and in Jackson here, most of the time, Athens 1 day a week.
Correct.
So you can be seen either place.
Either place.
Very good. Well, thank you for spending your morning with us. We appreciate it.
Thank you for having me.
So much. All right. Well, we do have a message from our friends at Benton County, and then we will be back on the other side with some news from Pete Wilson.
At Benton County National Bank, we believe in supporting the areas where we live and work. Now, we'd like to honor those who also serve our communities. Our new Community Champions account is especially for first responders, veterans, active military, and anyone employed in the fields of healthcare or education. This account offers rewards, discounts, and other benefits to those who give so much to others. Benton County National Bank, rewarding those who serve.
All right, and we are back with our good friend Pete Wilson. Thank God on this side of the election, as we got to spend some time dissecting some things yesterday, but there's probably, perhaps a little more election news. I don't know.
Well, we are doing, as we kind of said yesterday, we try to get, some numbers and basic information out as quick as possible on the website and for the radio and like that. And then we try to go a little more in depth for the next edition or editions, depending on, how much there is to cover. And we've begun that process. We will have some more comprehensive stories in our next edition, as well as a list of the actual votes if you just want to see numbers at a glance there.
Yeah, it's interesting.
We'll have that too, but just to kind of tease what we have coming, we have interviewed both Jackson Mayor Randy Evans and Jackson Police Chief Brett Hinch regarding the income tax, the city income tax, which was narrowly defeated.
Yep.
And, their dissection of that and what it means. And we also talk with County Commissioner Paul Haller about the aggregation issues that went down to the townships, to the township voters, just the township voters in Jackson County. And also talked to Paul about his own reelection as commissioner. Do you realize that Commissioner Haller, with his fourth term being elected to, he will tie Ed Armstrong for the longest tenure Jackson County Commissioner as far as being elected to terms.
Interesting.
Provided that we have Paul 4 years from now and he completes that term, he will tie Ed Armstrong. But as far as being elected 4 terms, that's a record.
Yeah.
So those sort of things. Also, Red Thompson Jr. has interviewed Lena Feather-Alf-Rogers, the Common Pleas Court Judge-elect. First female elected judge in Benton County history, she thinks, and so we're passing that along. It is. And also 2 new commissioners in Benton County. They have been interviewed as well. So we have all that coming. Also, an article from our state service about the issue 1, which was a big deal, kind of understand what that is and what that means. Of course, it did go down to defeat, even though polling, for the most part, indicated it would pass. It did not.
Was it close?
No, it was not that close.
Okay.
I mean, it wasn't like nip and tuck. They were able to call it as a loss fairly early in the process.
You know what I think, Pete? I think people lie to pollsters.
They do, or some people won't cooperate with pollsters, meaning that, you get that call, and, well, it's none of your beeswax how I'm going to vote.
I think they just lie. I really do. I think people are afraid to tell the truth.
I think
they're afraid they're going to be judged.
I think in some cases they are, if they have a sense of who might be calling them and what they want to hear.
Yeah.
Because you get that too. You get the candidates and their surrogates calling because they want to know, of course, the results too. And of course, they want you to be able to say what they want to hear.
Yes.
And
correct.
They may even frame questions that way.
Yeah.
They may say, why do you think this certain candidate is good, or why do you think that, they lead you that direction.
You're right. And I think people are very suspect of that now, as
Exactly.
they should be.
Exactly. All right, we're going to go over a few things real quickly here,
Okay.
Jennifer, and then, we'll share some of that in-depth election information too, because I found it interesting. I
Yeah.
just need to have the time to prepare it.
Yep.
But they have made an arrest in the Ohio Valley Bank robbery down at Rio Grande.
Oh, no kidding.
Exactly. That was on Thursday, October the 24th. And that suspect who was arrested is Brody A. Green, age 36 of Vinton. There he is.
Oh, Brody.
Now, Gallia County Sheriff Matt Champlin put out this information just on Tuesday. Didn't give a lot of circumstances on, how he came to be arrested or whatever.
Oh, okay.
But he is going to be charged with the robbery that took place October the 24th at the Ohio Valley Bank branch in the village of Rio Grande.
Right.
So I don't know how much money was taken there or whatever, but the suspect in this case, which of course Brody Green's been arrested, was disguised or whatever. And at the time that this happened, they didn't know who they were after. So some investigation success here.
Wonder what happened.
I don't know. Hopefully, maybe we will find that out. But we do have just kind of a local angle on that to also report. Jackson Police Chief Brett Hinch, who is investigating the October 21st armed robbery at the Jackson Express convenience store, because this one occurred 3 days later.
Right.
And you had a disguised concealed suspect.
It seemed maybe similar.
Right. Well, is there a connection? Because sometimes, robberies are done, repeat robberies are done by the same person. Now, he made it very clear to me, they have no concrete reason to believe that there is a connection, but they're going to check out to see if there might be.
Okay.
Because, right now, as he's been very honest with it, they didn't have a whole lot to go on that one. So that will be we have that story online. Also, we weren't able to report on this before because, we were talking, of course, all about the election, both before and after. But we had a serious injury-related accident out on U.S. Route 35. That occurred on Tuesday, Election Day, 7:55 a.m.
Oh.
And it involved a Mack dump truck and a small car. And Joseph Tanner, age 82 of Chillicothe, I believe, even though it's Chillicothe, I believe he might be a Jackson County resident with a Chillicothe PO. But anyway, he was driving there on US 35. This was at Savageville School Road, so that's west of Jackson, out there 7 or 8 miles, But he was making a left-hand turn and turned in front of the dump truck, and there was a collision there. And Mr. Tanner suffered what were described as serious injuries.
I'll bet.
Taken to Holzer Medical Center here in Jackson, and then flown from there to Grant Medical Center in Columbus. The truck driver, Keith Mandring, age 40 of Wellston, was not injured.
Okay.
So that story is online as well. All right. Speaking of Holzer, we want to tell you this too. Holzer Health System has announced. It's not a formal announcement, but they put a sign in the window, so I feel like we can report this. They're going to have a small clinic opening in Oak Hill.
Super cool.
Right. It's gonna. They announced a tentative soft opening, or at least by what they have in their window, on Monday, November the 18th. I know we're going to hear more about this probably next week, I'm guessing. But this building is on North Front Street in Oak Hill at the Jefferson Street intersection. It's in a building where there's a couple other businesses, Boggs Pest Control and Al's Pampered Pooches. And what we understand is that this remodeled unit, I think it's about ready to go, it will have a couple of exam rooms, a small lab where, things like blood work can be done.
Sure.
A medical provider will be on hand, as well as some nursing staff members. I'm sure we'll hear more about the schedule and all the services that might be available and how this fits in to medical services.
That's awesome.
In Oak Hill. Tonight, or this afternoon, I guess, it actually starts at, it starts at 6 p.m., so it is this evening. The Jackson Sidewalk Market will be out on the downtown streets of Jackson. Remember, always first Thursday.
Yeah, I know.
It comes around.
It comes so fast.
It comes around on you.
Yeah.
But always, as always, there'll be lots of street vendors. The existing businesses downtown, a lot of them will have extended hours, and food trucks there as well. And anyway, there's a special Thanksgiving theme. I think I'm guessing that Josie is behind this again.
I would say so.
She does so many nice things on this project, but they will. They've made it a Thanksgiving theme, and the vendor fees are going to go. All the vendor fees are going to go towards a project to have Thanksgiving food bags
Yes.
for needy people.
Yep.
And they hope to do 200 plus bags, and even though the vendor fees are going to be the main source of the revenue for the food bags, people who are downtown or online, they hear about it. They don't even have to go to the sidewalk market. They can donate to this very worthy cause,
Very good.
which is initiated by Josie and Faith of Fitness. But I'm sure that there's a collaboration with other people who are participating in the street in the sidewalk market, and by extension, if you're a vendor, you're going to be supporting it because that's where they're going to put the fees. All right. Do you realize? I know Veterans Day is coming up, but before Veterans Day, the Marine Corps is having a birthday party.
Okay.
This is a big deal across the country. The Marines celebrate their birthday. It's on November the 10th, and the party in Jackson County is going to be on the 9th, which is on Saturday.
Fun.
So it's just the way it works when the Marine Corps was formed. I believe it was November 10th, 1775 or something. So on November the 9th, it'll be the 249th birthday of the United States Marine Corps. I've been to these before. They do it upright. They're going to celebrate at the Jackson DAV at 170 Pearl Street, 5:30 p.m. There's going to be a free meal. Any World War II veterans and their families are also invited to come too. This is a family thing too for the families of Marine Corps members, both current and past who are veterans. But there will be a catered meal, free of charge. The only thing they ask is to call in advance if you're planning to come so they can make sure they have enough.
Okay.
And the way you do that is call the Jackson County Veteran Service Office and, of course, the service officer, Scott King, and Jennifer Pittman, the administrator there, 740-286-3004, 740-286-3004.
That's awesome.
Semper Fi.
Yes.
All right. Speaking of Veterans Day, a lot of Veterans Day assemblies and programs taking place in the community and in the schools. I know in the Vinton County schools, their programs started as early as Tuesday. And there's a program every day at least one school. I think the high school and middle school are both tomorrow.
Okay.
And I'm sure things are happening also in the schools in Jackson County as well. The big Veterans Assembly that they have in Wellston, which is really always something, is tomorrow. So I want to tell you about that. It's going to be at 10 a.m. There in the gym, and the whole community is invited. It's just not a school thing. I think they bring in all the school kids practically.
Sure.
I do think they do that. But it's also open to the community. The community gets involved, but the school, one of the school groups, I think, puts it on, of course, with the help of the school staff. And it will start at 10 a.m., and they will have also a free breakfast for veterans at 9 a.m. in the cafeteria.
Love that.
So just a big day. And then, of course, Hamden is going to have a Veterans Day parade on Saturday morning, late Saturday morning. The Veterans Day programs for Vinton County and Jackson will be held on Veterans Day morning at 11 o'clock.
And that's Monday, right?
Right, Monday.
Yeah.
Monday is Veterans Day, and that is a holiday, of course. Also, the Boy Scouts are doing their Scouting for Food drive in many parts of Jackson County. I know the Scouts in the Jackson area, at least, if you live in Jackson, you may have had a plastic bag put on your door or your porch. Just, like you get at the grocery stores.
Yes.
And there's a note in there. The idea is to fill that, and they'll
Yes.
pick it up Saturday.
Okay.
Or you can just go to the Christ Church,
Okay.
In Jackson, there on Portsmouth Street, and make a food donation. They're non-perishable food items.
Sure.
They do ask that no outdated items be donated,
Yep.
and make sure you don't do glass jars because things can happen with glass.
Yes.
There's many other kinds of non-perishable food that you can donate. So that can be dropped off in the parking lot of Christ Church Saturday from 9 a.m. to 10. Otherwise, the Scouts will be going back to the same places they dropped off the plastic bags this last Saturday.
Perfect.
Oak Hill Scouts are doing the project too, a little bit differently. It's called the Scouting for Food Project, by the way. They will be present at the at the parking lot of the Acorn Plaza there on Front Street by the City Building.
Okay.
They'll be there from 10 a.m. to 2 to accept donations of non-perishable food. So what happens to this food in Oak Hill, it's all going to go to the Oak Hill Food Pantry right there in Oak Hill, so you know where it's going. The Scouting for Food donations in Jackson, the way they advertise it, it will go to community food pantries. So it's going to be in Jackson County probably for sure, maybe, but not just
Love
the
that.
Jackson Food Pantry. Not sure if they're doing this in Wellston. Didn't get the word on that, but I'm telling you what I know. All right, and also, if you want tickets to the Jackson Bishop Watterson game, you know the drill now. If you've been to past playoff games, you got to get them online.
Yep.
Online, that's the only way to get them in advance. At ohsaa.org. There may be links with the school, like here at Jackson. I'm not sure on that. I didn't receive word, but you can definitely get them on the Ohio Athletic Association website, which is ohsaa.org/tickets. You can also get tickets at the gate, and that is not with cash. That is with cash only.
Yep.
At the gate, it's $11 for adults and only $5 for students. And if you're heading up there, we'll tell you in advance what the Jackson Bishop Watterson game is being played at Ohio Dominican University on
Yes, it
Sunbury
is.
Road, and the gates will not open till 6 for a 7 p.m. game.
Oh, okay.
So, don't go too early. Parking is free, so you don't have to worry about any extra charge there. And entrance is at the southeast gate. I guess you can figure out where that is when you get there, as long as you have your compass.
Sure.
All right, so there we are. I ran 6 minutes over. I apologize.
You're fine. You're fine, Pete. Well, thank you so much for tuning in this morning. Thank you for filling us in on the latest and greatest and all your news and your election coverage as well, because it's so interesting.
All right, well, we'll talk a little bit more about that Jackson-Columbus-Watterson game. I do want to say that we have a wonderful story in Wednesday's paper and posted where our sports editor, Todd Compton, wrote a story previewing the game, interviewed Coach Andy Hall, and gave us the lowdown on Columbus Bishop Watterson. And all I will say is they're very good.
They're very good.
Right. But so
Very good.
is the Ironmen.
So are we.
So are
yes.
the Ironmen.
Absolutely. All right. Well, have a great day, everyone. Thank you so much for tuning in. Thank you to Christina Hively for stopping by and telling us about what she does at Holzer. And we will see you right back here tomorrow. Have a great day. Bye-bye.
From breaking news to heartwarming stories, the Telegram is your ticket to the latest buzz in town.
Read your daily dose of local headlines, sports, and entertainment and more in hand and on paper.
Get a print and digital subscription for only $7.95 per month. Delivered fresh every Wednesday and Saturday.
Visit thetelegramnews.com or call 740-286-3023 today.
Don't just read the news, be a part of it.